Welcome to aminacademy.com. In human anatomy and physiology, let us discuss about disorders of the adrenal cortex. The adrenal gland disorders occurs when your adrenal gland make too much or too little hormone. Types of adrenal gland disorders include Addison's disease and Cushing syndrome. Symptoms vary widely depending on the specific conditions. Early diagnosis and treatment can help you manage these potentially life-threatening disorders. Adrenal gland disorders occur when your adrenal glands make too much or too little hormone. Your adrenal glands, just above each kidney, are small and triangular. They make hormones that help keep your metabolism, blood pressure, immune system, and stress response in balance. These hormones are cortisol, adrenaline, and aldosterone. Now, let us discuss further detail about disorders of the adrenal cortex. Disorders of the adrenal cortex involve each deficiencies or excess of the hormones produced by this outer layer of the adrenal gland. These disorders can manifest in various ways, affecting the body's regulation of stress response, blood pressure, and even sexual development. Adrenal insufficiency, Addison's disease. This condition occurs when the adrenal cortex does not produce enough cortisols and or aldosterone. It can be caused by autoimmune destruction of the gland or other factors like infections or tumors. Addison's disease, also known as primary adrenal insufficiency, is a rare chronic endocrine disorder where the adrenal glands don't produce enough of the hormone cortisol and aldosterone. This can lead to variety of symptoms and it, if left undertreated, can be life-threatening. Causes: Cushing's syndrome, characterized by excessive cortisol production, often due to pituitary tumors or long-term steroid medications use. This is a Cushing syndrome. Cushing syndrome is a hormonal disorder caused by prolonged exposure to high level of cortisol. This can be lead to a variety of symptoms, including weight gain, especially in the face, upper back, and abdomen, as well as thinning skin, muscle weakness, and high blood pressure. It can be caused by tumors in the pituitary or adrenal glands or by prolonged use of corticosteroid medications. Hyper Hyperaldosteronism, that is Conn's syndrome, involves overproduction of aldosterone, leading to high blood pressure and low potassium level. Congenital, congenital adrenal hyperplasia, that is CAH, a group of inherited disorders where the adrenal glands lack certain enzymes needed to produce hormones, leading to various hormonal imbalance. Next, adrenal virilism. What is that? Excessive production of androgens, that is male sex hormones, in females, causing symptoms like excessive hair growth in hirsutism and menstrual irregularities. Adrenal virilism is a condition in females or prepubescent children where excessive adrenal androgens lead to the development of male secondary sexual characteristics. This can manifest as excessive facial and body hair, deepening in the voice, and other signs of masculinization. It's a It's diagnosed by clinical signs and confirmed with elevated androgen levels. Treatment depends on the underlying cause, which may involve adrenal tumors or congenital adrenal hyperplasia. Next, adrenocortical carcinoma, a rare cancer of the adrenal cortex. Massive bilateral adrenal hemorrhage, that is Waterhouse Friderichsen syndrome, and acute conditions caused by severe bleeding into the adrenal gland, often linked to sepsis. Symptoms and diagnosis. Symptoms of adrenal cortex disorders can vary widely depending on the specific conditions and the hormones affected. Common symptoms include fatigue, weight can changes, skin discoloration, muscle weakness, high or low blood pressure, and in some cases, change in sexual development. Diagnosis often involves blood and urine tests to measure hormone levels, imaging scans to visualize the adrenal glands, and sometimes genetic testing for CAH. So far, we discussed about disorders of adrenal cortex. We have done. Please subscribe our YouTube channel.